Hello, my name is Dana. In studying for your NCLEX today, we're going to be talking about myocardial infarction. Now, I'm sure you remember that a myocardial infarction is also known as a heart attack. The patient will often present with left-sided chest pain. Now, this chest pain, in differentiating this chest pain from angina, this chest pain will be unrelieved by rest. And what I mean by that is a patient with angina can often sit and rest and their pain will subside. Where a person with a myocardial infarction, they'll sit and rest and their pain will not subside. So that might be a differentiating factor for us as far as if our patient is experiencing angina or a myocardial infarction. And myocardial infarctions will often radiate too. Often they'll start in the left chest and they'll radiate to the jaw or the shoulder or maybe even the back. But sometimes our patients will have atypical presentations. I'm an ER nurse and I've taken care of many patients, especially females, older females who come in with indigestion, complaints of indigestion. And when we work them up, or otherwise do all these diagnoses that are listed down here, when we work them up for a myocardial infarction, which we often do if our older clients complain of indigestion, it turns out they're not actually experiencing indigestion. What they're having is a myocardial infarction, and it feels to them like indigestion. Now, in working them up or otherwise trying to come to a diagnosis and all the testing that we're going to do an EKG where we're looking for ST elevation. We're going to draw cardiac enzymes. CKMB and troponin are two of the major cardiac enzymes. Now, how are we going to treat a myocardial infarction? Oftentimes, these patients will go to cardiac cath lab. But if they don't, if it's decided instead for various reasons that they're going to get a thrombolytic instead. Now, what I really want to get across here is the difference between a thrombolytic and an anticoagulant. Okay, a thrombolytic. Now, thrombus is a clot. Lytic, whenever you see that word, lytic breaks things up or kills something. So a thrombolytic is going to break up or kill a clot. So an existing clot, such as in a myocardial infarction. Now, examples of these are streptokinase and alteplase. We might give our myocardial infarction patient a thrombolytic to actually break up that clot and return perfusion to the heart. Now, I want to make sure that you understand the difference between the thrombolytic that I just described and the anticoagulant. Remember, our major anticoagulant that we often talk about is Coumadin or warfarin. Now, this is an anticoagulant, meaning that it's going to prevent a clot, right? We give these to our patients with atrial fibrillation, for instance, in order to prevent a clot or prevent a stroke in those AFib patients. So an anticoagulant is going to prevent a clot or stop an existing clot from getting larger, whereas a thrombolytic is actually going to break up an existing clot. Now, I have a question we're going to look at real quick. So we have a client with chronic heart failure who has atrial fibrillation and is taking warfarin. What should the nurse tell the client about the expected outcome of this drug? Now, as you look through these answers, I will help you out here. The correct answer is this medication will prevent a clot from forming. So remember, an anticoagulant such as warfarin prevents a clot from forming, whereas a thrombolytic breaks up an existing clot. And I look forward to going into much more detail about this and working together through more questions in the future. Thank you.